Welcome to another episode of Fridays with Fawn. I'm Fawn Lopez, publisher of Modern Healthcare and Vice President at Crane Communications. Joining me today is Dr. Janice Nevin, President and CEO of ChristianaCare. Dr. Nevin is a highly respected leader who has been named to a number of Modern Healthcare's recognition programs, including the top 25 women leaders, 50 most influential clinical leaders a number of times. Janice, it's a pleasure to have you here today. Thank you.
Thank you, Fawn. I'm excited to be here, and I really want to say thank you to you for the work that you do, especially over the last couple of years, keeping us informed in ways that were really helpful as we continue to manage through the pandemic. So thank you.
Thank you for those kind words. So let's get started. You joined ChristianaCare in 2002 as chair of the Department of Family and Community Medicine. How do you feel that your long tenure within the organization prepared you to assume the president and CEO role and oversee the many unprecedented challenges that came with the pandemic?
Well, thank you, Fawn, for reminding me that I've been at ChristianaCare for almost 20 years. And really, I think as I started my career at Jefferson in academic family medicine, and that's where I assumed I would finish my career. But I got the opportunity to interview for the role of chair at ChristianaCare. And when I came back from that first day of interviews, I remember telling my husband, you need to know if I get this job, I'm taking it. Because every single person that I talked to reflected on the mission of the organization, which is really all about serving community. The mission that I sort of embraced as I came in to healthcare. And I will tell you, for the last 20 years, I can look back and say that through the good times, the hard times, the times when things didn't go so well, we have always lived our mission. And that's frankly what has kept me here. And I believe also resulted in me getting multiple opportunities to really grow and develop my career. And so when I became the CEO toward the end of 2014, I had this great sense of being part of a community, of having had impact on the community, of sort of growing with the community, being part of an organization that had lived its mission.
Well, you have served the organization well, and the community and the organization are very lucky to have you as its leader. So
well,
congratulations.
Thank you.
I know that one of your top priorities is your Caring for Caregiver initiative. Can you talk a bit about how ChristianaCare is helping team members deal with PTSD, burnout, and other COVID-related conditions?
We were aware well before the pandemic of the significant burnout that healthcare workers experience. And as early as 2013, under the leadership of Dr. Heather Farley, who's now a national expert in this area, our chief wellness officer, really with her leadership, we started to create programs like Caring for Our Caregivers, responding, bringing people to patient care units when something had gone unexpectedly, understanding that there's a second victim, that the caregiver providing the care is also going to be suffering. And those programs led to what is now called the Center for Work-Life Wellbeing, which we established in 2016, again, well beyond the start of the pandemic. When the pandemic came to Delaware in March of 2020, I was just so grateful that we had this resource. And obviously, over the last 2.5 years, we've continued to invest in the programs. One of our most impactful programs has been creating a peer support network. We have over 300 counselors, if you will, peers, nurses who have been trained to work with other nurses across the organization, so that if a caregiver is experiencing some difficulty, there's somebody else who's walked in their shoes who can reach out to them and provide them the support that they need. We've also, we sort of laugh, can puppies and ice cream make a difference? The answer is yes. So we will bring therapy dogs in so that our caregivers can interact with dogs. It's amazing how that brightens people's days. We also, we've done things like chair massages. That has made a big difference, very popular. We also have had grateful sessions where we invite a patient and their family to come back and meet with caregivers, caregivers from the emergency department, where they may have started their care with us through ICU, through step down to rehab. And it's so important because in expressing gratitude, it reminds our caregivers of why they went into healthcare, and it's been incredibly healing. And of course, we have continued to invest in mental health resources. I think one of the things that Dr. Farley has taught me is the traditional employee assistance program is not enough. And this is a time when we have to look at what we're offering our caregivers, creating resources, helping them access resources for mental health, ensuring that they have, that we're covering the cost of those, that kind of care. So we have really, I would say, doubled down on what we are offering from a mental health perspective. Fundamentally, though, and I love when Heather talks about this. She says you can't sort of take the canary, fix the canary up, and then put the canary back in the coal mine. So some of the work that we're doing is how do we create a more sustaining work environment, make it easier for people to do what they love to do, what brings them joy and meaning, take out some of the friction that they experience. Ultimately, it's about preventing burnout and creating that environment where every caregiver can thrive.
So important, such important work. And thank you. Good for you for doing this. I understand that health equity or health inequity and racism in healthcare are also important priorities for you. What are some of the ways that you are trying to address these issues, challenges, not only at ChristianaCare, but in your community, if you can share?
Thank you for that question. And another topic we could probably spend hours talking about. Health equity for me has been part of my personal journey as a physician and as a leader. And certainly it's been part of our mission here at ChristianaCare. When I became the CEO, one of the first hires that I made was a chief health equity officer. And this was back in 2015 when people really weren't yet talking about health equity. But I knew that in order for us to achieve our goals as a system, to wholly care for our community, all the people who live in the communities we serve, that we would have to pay attention to disparities, that we could not be successful as an organization without investing in health equity. And so we've been doing this work for a while. Clearly, what we have learned from the pandemic is that these disparities are real. They have been there for a long time, and we've got to stop talking about them without acting on them. This is a time for action. We have to have impact. And so the work that we have done over the last 2.5 years really is built on a foundation that, again, we had put in place. Some of the work that we have been doing has been around, how do we know where the disparities are? So we've built a data infrastructure system that really is quite unique. It's based on the Gini index, which is often used to look at socioeconomic issues across the globe. We've applied that same sort of approach to data and technology. So we continually run algorithm, I would say algorithm, we use artificial intelligence It runs continually, and it lets us know where there is a disparity in a healthcare outcome, and then what is the cause of that disparity. And so we can see very clearly that, for example, when it comes to maternal child health, there are particular outcomes where race is the driver of that disparity. When we know that, we can then create a program and then measure the impact of that program on closing that disparity. And I'll give you a very specific example. We know that almost half of maternal mortality occurs after the delivery in the postpartum period, and hypertension is a major factor in that in maternal mortality. We identified the disparity that existed in our patients using the data technology that I talked about. We implemented a program, and frankly, the first program was sort of sharing broadly, please provide the clinical care in this particular way. And we realized very quickly that it wasn't having an impact. So then we created a very unique program run by a nurse practitioner using secure texting, allowing women to essentially report their blood pressure from their home, not requiring an in-person visit. And lo and behold, we were able to demonstrate with almost 2,500 postpartum women that we had improved the care, but also completely close the disparity gap. It's an example of, again, we need more of that. How do we know where the disparity is? What can we do to make a measurable impact? And then now, how do we grow that to scale? Much of our work also has been in partnership. We can't manage or impact health equity on our own. It's about deep partnerships. We partner with a technology platform called Unitas and have created Unite Delaware. And what this does, it connects patients to community-based organizations around the state. Those community-based organizations are expert in managing social care. We don't have to do that. We shouldn't do that. We need to invest in them and make sure that we are connecting people who need their services to them. And this technology helps make those referrals, but more importantly, it tells the provider the patient has actually gone to that community organization and gotten what they need. And one of our newer partnerships, which we're really excited about, is with a Lutheran church here. We are going to be delivering 20 meals to families who are part of our Medicaid ACO. We know that we can't just feed the patient, we have to feed the family. Again, helping them choose food that will enable them to be more healthy, to manage their diabetes or their heart failure, but also to provide for their family. And so we're going to be delivering those meals to homes throughout the community. I often say this work is it the right thing to do? Absolutely. It also makes really good business sense. That postpartum project that I shared with you, cost savings of over $300,000.
Wow.
When we do the right thing, we not only impact health, but it creates a system of care that becomes more affordable.
That is so great. Thank you for sharing the result, financial result, because many times we talk about some of these things and people wonder, that's the right thing to do, but how is it going to impact my financial health and well-being, our organization's financial health and well-being? This next question, I'm really excited to hear more about your Gene Editing Institute, which ChristianaCare launched in 2015 to accelerate cures and improve treatments. What is the mission, the vision, and the promise, and what has been the result that you've seen?
I always love saying this. ChristianaCare is the only community-based academic health system, I believe, in the world that has a gene editing institute. And it's all about the CRISPR technology. And I do believe that gene editing, gene therapy is the future of medicine. The potential to impact both diagnosis and treatment is extraordinary. It really is a seismic shift in terms of our ability to care for patients. What's so interesting is we have an extraordinary scientist here, Dr. Eric Kamesh, MIT, Jefferson, University of Delaware, could have gone to really any prestigious academic university in the country, but really wanted to be at ChristianaCare. He wanted to be embedded where patients and physicians are, because he needed to understand the real problems. He wanted his technology to bring solutions that would truly make a difference. And so, which is really unique. And I believe that that has contributed to his success. The numbers of articles that his team publish are often the most downloaded articles on CRISPR technology in the world. His team created, and I'm not an expert in this, so I hope I get it right, but essentially the ability to look at CRISPR DNA outside of the body to ensure that the technology had actually worked and that the right sort of cuts and edits had been made, and that's being used by other leading scientists now. And the most exciting news is that he's about to launch a clinical trial, which will be the first use of CRISPR technology in treating solid tumors, in this case, lung cancer and other head and neck cancer. I think the other thing I love about Dr. Kamesh, and I think one of the things that makes his work and his team unique, he is so committed to equity in the way that we've just discussed. He and I both believe that when we are introducing new technology, new knowledge, it should be available to everyone from the beginning. We've got to stop sort of getting to a point where 10, 20 years in, there's a disparity and now we have to go back and fix it. So he is absolutely committed to equity in everything that he does, the work that he does. Equity is a part of it. The other thing that he is committed to is workforce of the future. So one of the innovations that has come out of the Gene Editing Institute is called CRISPR in a Box. And his team has created a curriculum. They're in high schools, they're in our community college, they're in Salem College, an academy in North Carolina, the very first all women's school in the country committed to healthcare leadership. And he is creating the next generation of scientists, because these students learn about the technology and then they have the chance to actually perform the technology, get excited about healthcare medicine, maybe get excited about being a lab scientist. And he uses that also as a way to build trust. So we are intentionally working with schools where there are underrepresented minorities, and helping them understand the power of science in solving issues that may be really important for their community. Think sickle cell as an example. So the Gene Editing Institute brings science, equity, and workforce together in a way that's truly innovative.
Wow, that is so fascinating. And thank you so much for your work in this. Would love to know what is keeping you up at night. There's so much going on in the world and in healthcare right now. What is keeping you up at night, Janice?
Yeah, well, I think it's a miracle any of us sleep, I think, these days. Clearly the pandemic continues, and the impact of the pandemic will be with us for months and years. I remain deeply concerned about our caregivers, about workforce issues, the impact that the pandemic has had on our financials and what that means for our future. I get asked the question a lot about, well, this wasn't in your job description, was it? But, in many ways, I know I will look back at these 2.5 years and say, what a privilege it was to be part of this incredible organization, be part of this community during this time. So Although I do lie awake at night, I am extremely, grateful to be where I am. I think the other thing that for me it's created is a sense of urgency. We got to get to, the future landed on our doorstep as a result of COVID. We got to sort it out and get there faster. And our mantra at Christiana is all care that can be digital will be, all care that can be done in the home will be, and increasingly voice recognition will be how patients access care. And so I also sort of lie awake with that sense of urgency about how do we accelerate that work. Ultimately, our ability to be here and to be able to care for people well into the future, rests on our ability to make that transformation. It's what it's all about, is we have got to figure this out. I believe we can. I'm confident that we can, but our community is depending on us to do this.
Most definitely. And thank you for taking the ownership and the leadership position on this, because I'm hearing more and more from leaders like yourself that we have to do something about it. Nobody's going to do it for us. So let's just get moving and keep moving forward and figure out how to do it and with a sense of passion and urgency. So thank you.
I think that's true. Again, sort of when we're talking about healthcare, but also as we think about the issues of racism, for example. And so, in the aftermath of George Floyd's murder, we made a public commitment to being an anti-racism organization, knowing that it was not only important for the people inside our organization to understand that, but we needed to make that commitment to our community. We needed those that we serve to understand what we were doing. Healthcare organizations play an absolutely pivotal role in their communities.
Yep, most definitely. So let's switch gear a bit. If you were to go back in time, 10 years, what would you tell your younger self about leadership that you did not know then?
My younger self, and one with less gray hairs.
Join the club.
The thing that has accelerated over the last couple of years. I think I always understood the importance of values and how values, both personal values and organizational values, create resiliency. But I don't think I truly appreciated the power of that until we as an organization did some work. I'd been the CEO for a couple of years and, had sort of built a team, created a strategy. And I said, I think it's time for us to re-examine our values. If we are going to be successful doing all this work of change, we need to be resilient as an organization, not only as individuals. And I said, I want to do this work in a very different way. This is not going to be a leadership exercise. This, in fact, is going to be a conversation between our front line and leadership. And we are going to see what emerges. This was not a top-down approach at all. It was a bottom-up approach. And what emerged was our value statement. We serve together, guided by our values of excellence and love. We serve together, an expression of the importance of teamwork, not only the team that you're on, but the need to work across teams. Excellence, I always say it's in our DNA. It's about being exceptional today and even better tomorrow. But people don't talk about love in healthcare. It's not something that is generally in one's vocabulary. And love is certainly compassion and caring, but it's also embracing diversity. It's showing respect. And maybe most importantly, it's speaking the truth with courage and empathy. And what I've learned is when you lead with love, excellence is inevitable, and I believe equity is achievable. And I probably don't need to spend any time talking about how important that value statement has been to us over the last 2.5 years. I am so grateful to our organization, to the people that helped me do that work. We had a foundation and continue to have a foundation to do some of the really hard, challenging work that needs to be done. I don't think I could have appreciated that, how important that was 10 years ago.
Love the thought, the concept of when you lead with love, right? Mm-hmm. So Thank you. That's just, that resonates with me. So thank you for sharing it. Janice, it's truly been a pleasure and an honor talking with you this morning. Thank you for taking the time out of your busy schedule to join me today. And it's just been fantastic. So thank you.
Oh, absolutely. And again, thank you for all that you're doing. I mean, helping sort of grow our women leaders, so important. I really appreciate it. Thank you.
Thank you. And thank you everyone for joining us today, for watching Fridays with Fawn. And I look forward to seeing you at the next episode of Fridays with Fawn. But I do have a plug. Please don't forget to join us, actually join us at our 2022 Women Leaders in Healthcare Conference on July 14th and 15th in Chicago. Until next time, please stay safe and thank you.